Hi, this is Dr. Jared Moss with Regional Urology. Today we're going to be discussing Urolift. One of the first questions that comes to mind is, what is Urolift? Urolift is a simple device that's used to treat BPH in men. BPH in men is benign prostatic hypertrophy, or simple enlarging of the prostate that sometimes causes urinary symptoms in men, such as straining, difficulty getting empty, frequency, urgency, and getting up to urinate at night, which is called nocturia. The common question is, how is Urolift performed? It's an outpatient procedure that's performed in our ambulatory surgery center, which is our outpatient surgery center. It typically takes about 5 to 10 minutes to place a Urolift device. We do give you some slight sedation during the procedure so that you're asleep and very comfortable. Most of the time, a Urolift device can be placed without a catheter. Oftentimes, if I'm concerned that a man has an enlarged prostate or is at slight risk for being able to not urinate after the procedure, then we will place a catheter at the time of surgery while the patient is asleep, and then that catheter would be removed the following morning. Patients often ask how a Urolift device works, and the novelty of this device is it actually suspends the prostate. It doesn't actually resect the prostate or remove prostate tissue. So if you look down through a patient's urethra at the time of the surgery, and you look in and you see an obstructing prostate, so it's hard to see in the bladder, and after the procedure is performed, the channel is wide open. This is by taking the Urolift, and it's a clip device that basically the prostate lateral lobes will hang down into the urethra, which is causing obstruction and difficulty of urinary flow. By using several Urolift clips, you're able to suspend the lateral lobes of the prostate open, which allows the urine to flow down through the urethra and out of the body without any obstruction from the prostate. The benefit of these results is almost instantaneous. The other thing that's important when you're talking about performing surgery, whether it be for BPH or any surgery in general, is you always want to make sure that you select a good candidate. Certain procedures are good for certain patients, other procedures are not. So accordingly, with the Urolift device, it's important to make sure that you're a good candidate for this. The best way to determine if a patient is a good candidate for this is to perform two specific tests. One is a look in the bladder. It's called a cystoscopy. The other is a measurement of the prostate size. Generally speaking, you want someone with a small to moderate size prostate with obstruction. You typically want to avoid men with very large prostates or men that have a very large median lobe. And a median lobe, specifically to a patient, is a portion of the prostate that is essentially growing in or hanging into the bladder. And when the man urinates, the flap of the prostate sometimes will flip up and acts like a ball valve approach. It's not that you can't use Urolift in these patients, but they may be better candidates for a different type of surgery. So it's just important to discuss your anatomy with your urologist to determine if they think that you're going to be a good candidate for a Urolift. The look in the bladder done with a scope is typically done with the patient awake. It takes about 10 to 15 seconds to do this. It's just mildly uncomfortable, and we do give you some numbing medicine down through the urethra before this procedure is performed. After the procedure is done, then we will sit down, we'll go over the results of the ultrasound, we'll also go over the results of the look in the bladder to talk about what is your anatomy and are you going to be a good candidate for this procedure. One of the most important things that I like to discuss with patients before you do a surgery is, what should I expect after surgery? So we know that after a Urolift is performed that you're going to pee better with regards to urine flow. What's really important to stress to patients is that you're still going to have some occasional burning with urination. You may have a little bit of blood in the urine, and urinary frequency and urgency can be very normal for up to 6 weeks. It's also important for patients to remember that Urolift is the least invasive option when it comes to BPH surgery. So you're not going to get as dramatic of a result as if you did a more tried and true procedure, which is a TURP or a TURP. That being said, The risk of performing a TURP and the side effects are much greater, so there is some trade-off there, and those are things that are just important to remember when you're selecting the procedure that's right for you and discussing this with your urologist ahead of time. What are the risks of having a Urolift performed? This is an important discussion for any surgery that you're having, especially in the case of the Urolift too. Risk of general anesthetic, very minimal for a 5 to 10 minute procedure to insert a Urolift. Blood in the urine, urinary tract infection, some mild pelvic discomfort. Those are going to be the most common things that we see afterwards. Generally speaking, Urolift is one of the safest BPH procedures that we can perform. It's certainly the least invasive and the quickest. One of the nicest things about Urolift when it comes to surgical risk is the risk of sexual dysfunction. So when it comes to other BPH procedures, such as a TURP or a green light, the risk of retrograde ejaculation is nearly 100% if the procedure is formed correctly. What retrograde ejaculation means is that when a man ejaculates, the semen does not come out the tip of the penis, it goes back into the bladder, which is not dangerous, but then the patient urinates it out. This side effect is very bothersome for some men, so it's very important to discuss this ahead of time. The risk of sexual dysfunction or retrograde ejaculation with Urolift is very, very low. One of the other things that's important to consider anytime that you're looking at having a surgery performed is what are the alternatives, what are the other options. Certainly you have the option of continuing medicine, you have the option of doing nothing, you have the option of other surgeries. Other surgeries really depends on your anatomy, the size of your prostate, whether you have a median lobe, other health conditions, whether you've had urinary retention in the past. So there's a lot of things that factor into this decision-making process. The more tried and true transurethral resection of the prostate or the green light laser is another great option for many men. The downside to this is it tends to be a little bit more invasive. You typically have to wear a catheter longer. It's higher risk with regards to burning with urination, blood in the urine, risk of urinary incontinence, and risk of sexual dysfunction. But these are other procedures that you should be asking your urologist about to differentiate this from a Urolift to decide which procedure you're the best candidate for. One of the final questions that patients have is, does insurance cover Urolift? Almost universally, insurance does cover Urolift. This is something that would be verified ahead of time, whether the insurance covers it or not. If there are any outpatient costs to you, then this would be communicated ahead of time to be able to help you make your decision whether this is the right procedure for you. So to review, we've talked about what Urolift is. It's a device that's intended to suspend the prostate. It's one of the safest, most effective, fastest procedures that we can perform. It's performed in an ambulatory surgery center. It's outpatient. Most of the time, this can be done without a catheter. The results are almost instantaneous. It is important to remember that you can have some burning with urination, a little bit of blood in the urine, some mild pelvic discomfort, and it may take about 6 weeks for your bladder to get retrained for you to see the maximum results from Urolift. Remember that the risk of sexual dysfunction is almost zero. Another thing that's important for men, and one of the things they ask, is if I choose to do a Urolift and I don't get the results that I thought I was going to get, or what if my prostate continues to grow and I need another procedure down the line? I need something more invasive like the traditional TURP or green light. Would I still be able to have these procedures performed down the line if I needed them? The simple answer is yes. If you need something down the line or you choose to do something different down the line, this does not burn any bridges. I hope this information is helpful. Please use this to discuss with your urologist and help make the right decision for you.